Hi, welcome to Whazzup. I'm Raymond.
And I'm Joanne. The Singapore Turf Club is an equine facility with more than 1,000 horses participating in races on a weekly basis. Much care has to be offered to the stars of the track.
That's why in this special feature, we follow a vet nurse and find out the intricate details of the job, including behind the scenes at the Equine Hospital.
We are here at the Equine Clinic, where horses from various stables come for their medication and treatment.
Well, it's a busy place for the vet department. That's why we are going to meet our guests of the shows in there. Let's go!
I'm Bridget Lee and I'm a vet nurse. I've been working as a veterinary nurse for nearly 5 years now, and I got into the job basically because I'm an animal lover, but I also love working outdoors and in a team environment, and I really enjoy the science behind vet nursing. So now we're down at the veterinary clinic where horses come down for, if they're on scheduled daily treatments, they come down and get those, or if they need to be checked for a lameness or checking their airways with a scope, we can do all that down here. So I just assist where I can, assist the vets, or maybe just do some injections. So we'll just wait for some customers.
There is a huge array of tasks at the clinic, where the bulk of work derives from administering medications to horses, either through injections or orally.
This is what we call a saline drink. It's an electrolyte drink basically for horses, and to give it we need to insert a nasogastric tube which goes through their nose and down into their stomach. Some other things that we do quite often is an amino acid drip. So it's sort of the same idea, replacing electrolytes, but it's given into the vein. And here we have the list of retreatments that we do every day. So once a horse is prescribed so many days of a treatment, it's listed down here. So when it comes in the morning, we can find it on the sheet and know what it needs to get.
In between their duties, they must also respond to emergency calls and react immediately.
I've just received a call from a trainer who wants to have their horse sedated. So we'll take the sedation down to the stable and let's go do that. So this horse has been on holiday and he's just feeling a bit fresh. So we're just going to give him a little bit of sedation so that they can walk him and exercise him, get him back into the process without him hurting himself. The main role of a veterinary nurse is to assist the veterinarians. So this might be offering another set of hands to help with certain procedures, setting up equipment or preparing equipment. I also need to make sure that the hospital is always in working condition. The equipment is in good working order and the instruments are sterile and everything is clean.
Back at the clinic, the vet nurse continues to assist the vets in preparing the horses for minor procedures as well as cleaning the equipment after procedures are completed.
There's a few differences between working in a racing industry type practice and a companion animal type practice. Not just the size of that patient that you're treating, but also because of the difference in purpose for the animal, we offer slightly different treatments.
Apart from minor procedures, the vet nurse also assists with surgery preparations by clipping and shaving the horses to put it in a catheter for surgery.
So we've placed the catheter, now we're just going to prepare the limb. So he's having surgery on his right knee, he's having an arthroscopy to remove some bone chips. So Sam's just clipping the leg, and then we'll give it a scrub and wrap it up, and then we can go up to surgery.
There are always risks involved in any job, and being a vet nurse, one must be emotionally and physically prepared when working with sensitive animals like horses.
To be a vet nurse, you have to be very patient, not only patient with the animals, but also sometimes the people you work with. You have to have a bit of sympathy for them as well and be very compassionate.
But at the end of the day, there are bound to be memorable moments on the job when you are an animal lover.
It's always really rewarding to see horses going back home, or especially going back into racing after you've spent a lot of time with them. I have been treating a wound for over 6 months this year, and the horse is finally back racing, so that's really nice to see.
Wow, that was a real eye-opener in there. You've just seen what the duties of a vet nurse entails at the clinic, and if you think the work of a vet nurse is just all that, you are wrong.
It is much more than that. A vet nurse that works in an equine facility has to help out with various aspects of horse care. So now let's go to the hospital to see how they assist the vet in surgery.
In the hospital we have patients who we are monitoring closely. So So they might have just completed a surgery, or they might be ill with colic or some other disease.
Surgeries take place at the Equine Hospital and horses are prepared for surgery outside the operating theatre.
When the anaesthetist is ready, we're going to bring the horse into the knockdown room and he'll anaesthetise him with intravenous drugs. Then we'll put him on the hoist and bring him through onto the surgery table where he'll be on his back, and then he'll be connected up to the gas anaesthesia. And from there, the surgeon and I will scrub in, so we'll get our hands prepared, put gowns on, gloves, and then we can start preparing the instruments and then begin surgery.
The operating theatre is a fairly huge room with special floor-to-ceiling antibacterial coating. Heavy-duty surgical equipment is needed to maneuver and operate on the large patients. After that, it is a matter of scrubbing in and getting started. Prior to surgery, the vet nurse will prepare the necessary equipment to support the veterinary surgeon. Care is taken to ensure the instruments remain sterile at all times. During the actual surgery, the vet nurse will assist the veterinary surgeon by providing the correct instruments. Certain chemistry is required to work in tune with the vet. For certain procedures, the vet nurse is given the opportunity to practice their skills under the vet's supervision. At higher levels, vet nurses may practice their skills autonomously, including performing minor surgeries. After surgery, the patient is moved to a specially padded recovery room to rest.
We can watch him recover on a TV screen. We have cameras inside, and we can also get them on our iPhones.
The work of a vet nurse does not stop there. He or she is still required to look into the various aspects of both inpatient and outpatient care. On a daily basis, the vet nurse will go on rounds to the stables for medical follow-ups, such as cleaning and dressing wounds, as well as administration of medications.
We're here at the stable to change the bandage of a horse that had surgery about 9 days ago. He had surgery on his knee, an arthroscopy, so he's finished his treatments now, and we're just changing the bandage until it's time to remove the sutures. He has to be confined in the stable until he's healed, so that's why we have to do it here and the horse can't come to us. This horse is a little bit cheeky and he tends to attack his own bandage, so we're just going to put a little bit of Cribox on it just to discourage him from chewing it. This horse had surgery 10 days ago, so he's ready to have his stitches taken out. So from that point on, he doesn't have to wear a bandage anymore. And he's been off treatment for 5 days, so we'll just take the stitches out and the bandage off.
When the stables are taken care of, it is another visit to the hospital.
This horse had surgery on Tuesday to fuse her fetlock, so it was quite an intricate procedure and she needs to be closely monitored. So Dr. Oliver and I are going to change her bandage today and check that all's well underneath.
Grooming the horses after treatment provides them much comfort too, and not forgetting to feed a special patient.
So back here we've got our horse that had a bone scan yesterday. So he's radioactive and we try and have minimal contact with him. So we just check that he's okay, give him some feed, top up his water and leave him to it. Well, that's it for today. We've done all our jobs, all the horses are happy, paperwork's up to date, it's time to go home.
Well, we hope you enjoyed these special features on the Vet Nurse.
For racing information, do log on to turfclub.com.sg.
Bye!